I realize that I've taken on much too much here, and I'm going to give you a really whirlwind tour. So hopefully bear with me. It's going to try to cover a lot of ground in a very short time. Um, so the to start off talking about resettled refugees, um, so when we think of resettled refugees, we often think of the Syrian refugees who arrived following the war in Syria, and that's a good example of the situation where the people essentially who fled their country due to war or other types of violence, usually to a neighboring country, and who've been there for X period of time, often in camps. And Canada accepts a small number of refugees every year, very small number, but a few thousand. They're referred by the United Nations High Commission for Refugees, identified as refugees, and then go through a selection process overseas by Canada. And when they arrive here, they are permanent residents on arrival. They have all the rights of a permanent resident. And in addition, when they're arriving in Quebec, they have RAMQ coverage as soon as they arrive. There's no waiting period. They also benefit from coverage under the interim federal health program that I'll be talking about in greater detail shortly. But in the case of resettled refugees, it's during the first 12 months only, and it's for non-medical services, including things such as psychotherapy. So they have RAMQ coverage like anybody else who has RAMQ, plus certain coverage of certain non-medical services under the IFHP. As well, during there are refugee clinics that are set up across Quebec that will offer medical and psychosocial assessment and referrals during the first few months for resettled refugees. And they also have support from community groups that are funded in part by the government. So if they're government-assisted refugees, they will receive public support, which is equivalent to welfare during the first year, as well as being supported by resettlement refugees that are NGOs, publicly funded. If they're privately sponsored, they may be sponsored either by charitable groups, faith groups, community groups, or by individuals who get together and agree to sponsor a refugee. It's a large, heavy undertaking because it means providing financial support for the full first year, as well as guiding the person and helping them get settled. So it's great to have that. Resettled refugees are in some ways in a good position in that they have full rights as permanent residents and full RAMQ coverage upon arrival. On the other hand, they're generally people who have a lot of vulnerabilities, who've been exposed to a lot of hardship, often to trauma before arrival. And in that regard, 1 year support, although it's wonderful, is really not enough. So as I say, there's a whirlwind tour, so I'm just really quickly sort of talking about resettled refugees here, but just to give you a sense of their situation. But they do have access to services, although they may have difficulties exercising those rights, particularly due to, in some cases, to language issues, because of course they're not selected on the basis of language. So many do not speak either French or English. Moving on quickly now to asylum seekers, also known as refugee claimants. So again, sort of a typical image in the last few years, at any rate, many have been coming to Canada via from on foot and by public transit and so on, from through Latin America and crossing the infamous Darien Gap in the jungles in Panama, undergoing tremendous hardship and often abuse in the process. Others come by plane. There are all kinds of ways of arriving as a refugee. Some used to be come by across the U.S.-Canada border at Roxham Road, which has been closed off since last March, but they continue to come otherwise, often now by plane. And essentially, people who are asylum seekers come on their own steam. They're not chosen in advance. They're certainly not authorized in advance. But once they arrive here in Canada, they have the right to ask for protection and to not be sent back to their country of origin And those rights are exercised under the Refugee Convention, or also known as the Geneva Convention, that Canada has ratified, and is ratified by most countries around the world for that matter. So what that means is that as soon as a person makes a refugee claim, says, I need protection, don't send me back to my country, from that moment, they are protected as asylum seekers or refugee claimants. They can't be deported back to their country while they're waiting for their claim to be processed. They have fully legal status as an asylum seeker. It doesn't matter whether they entered illegally or with false papers. They are protected and have full legal rights as an asylum seeker, which is a temporary status. They have the right to a hearing before the Immigration and Refugee Board that will determine in a decisive manner whether or not they are accepted as refugees and can actually stay here more permanently. But in the interim, they have access to a number of rights and services. And eventually it's the IRB that will decide if they are refugees in the sense of the convention. That is to say, they have to prove that if they were sent back to their country of origin, they would be at risk, seriously at risk, their life or their survival, well-being would be at risk for a certain number of reasons, such as ethnicity, religion, political opinions, sexual orientation, gender, or various similar grounds. So, but as I say, I'm talking here more about their situation while they're in the waiting period, which can last, unfortunately, nowadays, often 2 or 3 years waiting for the hearing. So what is their situation there? And sorry, I didn't get around to translating the table, but they have a number of rights which are important. They have access to shelter during the first weeks after arrival that is managed and provided by PRIDA, which is a Quebec Health and Social Services agency. That also provides psychosocial assessment and referrals and so on in the first weeks after arrival. They can apply for aide de dernier recours, social assistance. They have the right to an open work permit upon arrival. Often takes some time to get it, administrative delays, but they actually have the right to the work permit. As I will talk about later in greater detail, coverage of healthcare under the IFHP. The children can go to school and so on and so forth. There's a number of important rights and services that they have access to. Others, unfortunately, that they do not have access to, and one of the most problematic is they don't have access to subsidized daycare, which is a huge barrier for integration into the workforce, and especially for women. And there are a number of other important services that they do not have access to. I don't have time to go into detail on this, but they have some rights, not others. But what I wanted to talk about more specifically today is with regard to access to health and social services. So in terms of health, they have, as I mentioned already, the coverage of the Interim Federal Health Program, the IFHP, from the moment they make their initial refugee claim up until the time that they either are accepted as refugees or definitively rejected. And it's really an excellent program. Essentially, in terms of medical services, it's virtually identical to RAMQ coverage. It covers 100% prescription medications, and it provides coverage of a number of other services, although in that case it's with usually with pre-authorization, but many things that are quite useful and important, including psychotherapy for up to 10 sessions, but renewable on referral by a family doctor, psychotherapy with a licensed psychologist. So is covered by the IFHP, at least up to a certain fee level. So as I say, good coverage in principle for asylum seekers. In reality, a lot of major barriers to healthcare access. In order to be an IFHP service provider and to be able to claim reimbursement of their fees, health professionals have to register with Medavie Blue Cross, which is the administers the program on behalf of the federal government. And unfortunately, very, very few health professionals or clinics actually register as providers. And if they're not registered, then it's a free market situation. That is to say, the health professional can either simply say, I don't accept asylum-seeking people with IFHP, or IFHP, I'm not a registered provider, just pay me whatever amount. And there's no, it's not regulated. So the only place where asylum seekers can be sure to receive free healthcare under the that they're entitled to under the IFHP is at the emergency in the hospitals. Hospitals have to be registered IFHP providers. However, even in the outpatient clinics, still it's the doctors who decide. If the doctor is not a registered IFHP provider, then they can say, well, try to see one of my colleagues, try and look around and see if you might find somebody here in the clinic who provides services for free to asylum seekers. So it's extremely unsatisfactory, to say the least, for asylum seekers. There's no reliable list of the clinics and professionals that provide services under the IFHP. So they can, go to their neighborhood clinic and get turned down, get turned away, or asked to pay for services which they should be receiving for free. And many, unfortunately, end up going to the emergency because it's the only place where they're sure to get services. Why the reluctance to become IFHP service providers? Partly it's simply because the program is poorly known, poorly understood. Many physicians and other professionals are concerned that it may be a time-consuming to provide services, and it is indeed. It does take more time because when people are unfamiliar with the services. Asylum seekers often have significant psychosocial needs. There may be language issues and so on. But perhaps even more importantly, there are systemic barriers. So the Ministère de la Santé et des Services Sociaux does not count IFHP patients when they're deciding whether physicians and clinics have met their targets, which, as you know, they need to provide services to a certain number of patients per year and within a certain time frame. Well, if they accept an asylum seeker with the IFHP coverage, it's zero. So that means that, of course, they're asylum seekers are competing with RAMQ patients who do count for in the patient load. And it's a major disincentive. And similarly, physicians get basic rates. They don't get premiums that they would be entitled to for other high needs patients. Other systemic barriers, simply the fact that all online systems, like all the systems that you have to go through now, get an appointment. What's the first thing they ask? They ask you for your RAMQ number, and you can't get around that at the moment. I mean, it's something that many other people are trying to ask that they make it possible. But all of these are reasons why, although entitled to good healthcare coverage, in fact, asylum seekers have a tremendous amount of difficulty getting to that care. And that's apart from the other, language barriers and other things that they may have, they may share with other newcomers. So far as psychosocial services are concerned, they're generally not covered by the IFHP. They're meant to be provided by provinces, that's in Quebec and CLSCs the same way they're provided to the rest of the population. And CLSCs have a populational mandate, but there's no clear direction. There's no clear policy on behalf of on the part of the Ministère de la Santé et des Services Sociaux that to say to CLSCs whether or not they must provide equal services to asylum seekers and other precarious status migrants or non-status migrants for that matter. So it varies again from one CLSC to another to some degree, or from one CIS to another. Some provide same services to asylum seekers as to any other member of the population. Some put restrictions. It's very hard to know. It's actually something I'm just starting to work on. Is a project to try to document the different services. There's no clear, consistent policy on that. And I mean, asylum seekers need a lot of psychosocial support, especially during the first year after arrival. They have a tremendous number of needs. They're in a very, very insecure situation. They're very, very stressed, in addition to all the pre-migratory trauma or hardship that they may have experienced. So it's true that they have lots of needs. And unfortunately, we're, of course, in a situation where there's a lot of competition for scarce resources in the public sector. And that makes it very difficult. So again, say just a quick look at some of the main issues. So I'm going to move on now to the third group that I want to talk about, were medically uninsured migrants. This is a very heterogeneous group because it includes, yes, people, non-status migrants who are without official status, but also people with temporary status, such as most international students, some people with work visas, specifically with open work visas, people with visitor visas. When we talk of non-status migrants, we're talking about people who have been refused, their refugee claim has been refused, and they decided nonetheless to stay on in Quebec and Canada, or people whose temporary visa has expired and who've decided again to stay on, often while they're waiting to get to renew their visa, but or in the case of refused refugee claimants, they may be have applied for humanitarian status or be sponsored. So many people are trying to get regularized, but in the interim have no status and no public health coverage. And we don't know the numbers. We think maybe 50,000, maybe 70,000 in Quebec, but again, there are no official numbers. So when we talk about adult migrants, they essentially, if they're uninsured, medically uninsured, that means that they must, in all cases, pay for services. If it's a medical emergency, they receive the service and are billed afterwards. If it's not a medical emergency, they have to pay in advance, otherwise they don't receive any medical services. And not only that, but hospitals, the official policy of the MSSS is to instruct hospitals to charge 3 times the institutional rate, the RAMQ rate. And this can add up to very high numbers. So to take the example of pregnancy and childbirth, so first of all, unless the woman is admitted on an emergency basis, means that she's admitted when she's in labor, she has to pay, depending on hospital, between $7,000 to $15,000 as a deposit, which is a huge sum for anybody, I would say. And you can see some of the amounts that are charged here. So it's very, very high fees that are not really accessible to most people. And people end up with debts afterwards. There's only one clinic really that offers general free frontline medical services, the Médecins du Monde Migrant Clinic, and it's very, very limited because they work primarily on with volunteers, doctors and social workers and so on that volunteer their services. They have a very limited number of paid employees. So the people who are uninsured are in a very, who are adults particularly, are in really, really a difficult situation, extremely. In the case of children, there's been a huge step forward in recent years. Bill 83 was adopted here in Quebec in 2021. And basically what it says is that all children who are immediately entitled to RAMQ coverage, as long as the family or the child will be in Quebec for more than 6 months, regardless of the parent's migratory status. So that applies certainly, of course, to children born in Quebec, but it also applies to families who arrive here with children who are born elsewhere. The only exception in that case is children of asylum seekers because they already have IFHP coverage. But otherwise, all children now in Quebec are entitled to RAMQ coverage as long as the family intends to be here for more than 6 months. So it's wonderful. It's a huge step in advance. It's we're in sort of in l'avant-garde even in world terms in that regard. However, there are lots of application problems still. It's still not well known. Most hospitals and doctors, for example, continue to charge fees for the first months of care after a child is born, just because there are administrative delays to get the RAMQ card, and they should be providing the service free of charge, but they're not. Anyway, that's Médecins du Monde and many others, many of us working in the advocacy on that to try to get that resolved. But the principle is there, so that's very important in of itself. So to wrap up, I will this whirlwind tour. I wanted to move on quickly to talk a little bit about Bill 96, so language area, and the impact specifically on public service language in the public service, and specifically in the medical or health and social services area. As you know, of course, major bill that covers all kinds of areas in Quebec. I'm only going to be talking about very briefly specifically the language of communication between public sector employees and individuals, which is in effect since June 1st this year. However, the exact scope of those provisions and how they'll be applied is still uncertain, because they still have to be determined by directives that must be adopted by the end of the year by various ministries. So in the health and social services sector, it will be the Ministère de la Santé et des Services Sociaux that will be adopting a directive by the end of the year. And so what I'll say briefly is what is in the law, but we don't know yet how it will be applied specifically. In the public sector, what the law says is that public sector employees are not permitted to use languages other than French. So French only, unless, and that includes both talking directly to people that provide services to, or providing services via an state-funded interpreter, unless it's permitted by the law to use another language. So the main exceptions, won't go into detail here, but include people who attended school in English in Canada, Indigenous persons, newcomers, but only during the first 6 months after their arrival, and only for services that are related to their initial settlement. And then where health, public safety, and principles of natural justice so require, and that's directly the quote from the law, what exactly that means remains to be seen. And also bilingual institutions continue to have the right to provide services in English. In the health and social services sector, what that means, so in French, it's the status quo. We have the right to receive services in French in all institutions. It must be offered in French in all institutions, which is extremely important, and as it should be. In English, it's largely in designated bilingual institutions like the MUHC or the in the Centre-Ouest or various other bilingual health and social services institutions. There continues to not only be permitted, but to offer services in English, but English speakers can have the right to receive services in English upon request. Elsewhere in the health and social services institutions, it's the general principle of the law that applies, so services exclusively in French, except for the groups mentioned earlier. And where it's really the most problematic is for people who need services in other language, because essentially it's forbidden to provide services in other languages except French or English, where it's permitted. except during the first 6 months after arrival of newcomers, or if health, public safety, or natural justice require providing the service in another language. So huge question marks about the possibility of providing services to newcomers who have been here for longer than 6 months, but who don't speak French well, or certainly don't speak it well enough to ask for health services or social services and explain what they need, or other types of services that are provided by in the public sector for that matter. So we're waiting for the directives from the MSSS. It's possible that, and I think, in fact, perhaps fairly likely, that the MSSS will want to give a very broad interpretation to the exception of where health, public safety, or principles of natural justice so require. They could even try to say that, in all cases where health services are provided, it's important to be able to communicate in whatever language is necessary. But at this point, we simply don't know what the ultimate outcome will be. So we are looking forward to find out what that will be, what the situation will be. So thanks very much for your patience.